In this session, we are going to answer questions that most of the people ask themselves regarding how to live positively with HIV and AIDS. Is it safe to play with someone who has HIV?
Yes, HIV is only spread by coming in contact with certain body fluids from a person who has the virus. The body fluids that can carry HIV are semen, vaginal secretions, blood, the breast milk. You cannot catch HIV from hugging, no, or holding hands, or being near someone who lives with HIV and AIDS, no. No worry, you cannot become infected from a toilet seat, a drinking fountain, a doorknob, dishes, drinking glasses, food, or pets.
Does male circumcision prevent HIV transmission?
Normally, research has shown that when someone undergoes male circumcision, this helps him gain nearly 60% of reduction in the risk of HIV transmission. The male circumcision also reduces the risk of infection in the incidence of sexually transmitted infections such as syphilis, chancroid, herpes simplex virus, genital ulcer disease among men and in their female partners. That's why since 2007, WHO and UNAIDS have recommended the voluntary medical male circumcision as an additional strategy for HIV prevention. This was recommended in countries where was observed high level prevalence and with low level of male circumcision. Normally, male circumcision should always be considered as part of a comprehensive HIV prevention package. It should never be replaced by other known methods of prevention, such as female and male condoms. You have to remember that if you are circumcised and that you do unprotected sex, there are still chances that you may get infected by HIV.
What is the benefit of an HIV test?
Knowing your HIV status can have two important benefits. If you learn that you are HIV positive, you can take steps to access treatment before symptoms appear. You can now have access to care and support. Knowing that you are infected helps you potentially living longer and prevents you from health complications from many years. The second benefit is if you know that you are infected, you can take precautions to prevent the spread of HIV to other people.
How long can people live with HIV and AIDS?
Medicines that fight HIV have helped many people with HIV and AIDS to live years and even decades longer. It was not possible in the past before effective treatment was available. HIV treatments are not a cure and they do not work equally well for everyone, but they have extended the lives of many people with HIV and AIDS. But every person is unique. Without treatment, some people live for just a few years after getting HIV, while few others can live much longer. Researchers are currently studying the immune system of a small number of people with HIV and who have not become ill for more than 10 years and without any HIV treatment received. However, these people are still infected with HIV and they can pass the virus to other people.
Can I get vaccine to prevent from HIV infection or AIDS?
No, there is no vaccine to prevent HIV infection for now. Researchers are working to develop one. Vaccines in development are being tested to find out if they work, but there is not yet one found and confirmed yet.
Or can a woman who has HIV pass the virus to the baby?
Yes, a woman who has HIV can pass the virus to her baby during pregnancy, delivery, or breastfeeding. Normally, women with HIV are given medicines during pregnancy, labor, and delivery in order to maximize the protection of the baby from getting infected. Those medicines are even given to their babies also after birth. It is best for women to know their HIV status before they become pregnant, or at least know the status while they are still early in their pregnancy. If they know, it helps them to make informed decisions and take full advantage of these medicines. Since HIV is also found in breast milk, women with HIV should not breastfeed their babies.
Is there a cure for HIV or AIDS?
No. There is no cure for HIV or AIDS. However, there are medicines that fight HIV and help people with HIV and AIDS to live longer and healthier.
Can I get HIV from living in the same house as a person with HIV or AIDS?
Normally, there have been no reported cases of HIV transmission from casual contact while living with a person with HIV or AIDS, even for a long time. However, there have been reported cases where household members become infected with HIV as a result of direct blood-to-blood contact, such as sharing razor or toothbrush, getting stuck with a needle, or by getting infected blood on a rash and or open wound.
Is there a 100% effective way to prevent sexual transmission of HIV?
The only 100% effective way to prevent sexual transmission of HIV is through abstinence. This means avoiding all vaginal, anal, and oral sex. Using a latex male condom or a female condom can greatly reduce the risk of HIV transmission, but it can't entirely eliminate it. So abstinence is the only method to completely eliminate the possibility of sexual transmission of HIV.